Exercising well gives you a whole new way of thinking about, feeling about, and doing exercise in a way that optimizes what you get from it. For many people, exercising is stressful. It's time consuming, it's painful, it's confusing, it's embarrassing, expensive, and a constant should hanging over their head. We hear so many of the benefits of exercise, but we're rarely taught how to do it in a way that reduces stress and improves your strength, stamina, and mobility in a sustainable way for your whole life. Midway through my career as a clinical exercise physiologist, I started integrating movement science with motivation science and mindfulness. Clients and patients started enjoying exercising, even the ones who told me that they hated to exercise. They started moving without pain from day one, even the ones who were limited by chronic pain. And they found themselves motivated even without someone or something making them do it. The bonus has been hearing the carryover to how they eat and manage stress. Every health habit got easier. The Be Well Now method is the way to simplify this whole person's science based approach to exercising. The podcast does more than tell you what to do and why it's important. I coach you to learn from both movement science and motivation science, but most importantly, from your own inner science to unleash what only you know inside about how to be well now. Today, I am so happy to have Dr. Jan Anderson with us. As a psychologist who specializes in working with high achieving executives and professionals, and with an expertise in mindfulness, Dr. Jan has a unique perspective on taking the stress out of habit change. Dr. Jan offers a top down perspective to this method. In our conversations, we have a lot of fun making health habits simple, sustainable, and enjoyable. Share this episode with someone that you know. Hi, Dr. Jan. It's
Hi
good to see
there.
you. Welcome to the Be Well Now Method podcast. This is our first episode together on this podcast, the first of many, though, because I am so excited to bring our conversations into this setting.
Yeah, me too. Me
Yeah.
too.
So,
And
what's
I've
on
got,
your mind today?
I have a hot topic and a question about it
Awesome.
to,
Love
to
it.
kick this off. Yes, there was an article last week highlighting how midlife women are beginning to really embrace strength training,
Mm.
do,
Yeah.
working out with weights to
Great.
build
Great.
strength. And I know from working with you and other things I've read that 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 strength training is a really important part of aging well and of course exercising well. So uh, actually though I felt disheartened after I read the article. It actually wasn't motivating or helpful to me. It actually was kind of a downer.
Huh.
And
Wonder.
here's the good news. Here's the good
Okay.
news is in spite of that, I am doing strength training, and I just recently went from once a week to twice a week. So
Oh,
it's not stopping me, but that's because of the exercising well methodology. If I didn't
yeah.
have that, I would have read that article and actually been demotivated
Yeah.
to
Okay.
do it. And that's why I
Yes.
want to talk about it because that's not the reaction you want
Mm.
people to have when they read an article like that, to feel
Right.
demotivated.
Yeah. I'm sure it wasn't the intention of the author writing the article. So let's dive in and see, because I'm sure other people had that same feeling. So tell me more about the article and what was the reaction?
The main thing that was problematic for me is it came off like every example was some woman in her 50s or 60s, and now it's not just doing strength training, but she's a bodybuilder now, or
Mm.
she's competing, or she's working behind the desk at a gym now. She's retired and working behind the desk of a gym now because she's so into this
Yeah.
this new way of this new habit. We'll put it
Okay.
that way. Uh, so, and not to say that what they're doing is wrong.
Yeah.
If that's working for them, I'm just thinking that the average person out there
Hmm.
we don't have that kind of lifestyle or that kind of time, or just it's such a high standard. It's
Yeah.
like, why does everything always have to be extreme
Hmm.
and over the top
Yeah.
to be any good?
Yeah.
And, like I said, the good news is it's not stopping me from doing my, if you look at my little pathetic workouts in comparison,
Comparatively.
yeah, comparatively speaking, it's like, okay, so here I am doing my little pathetic thing. It's like, why even bother? Because this is, you know,
Right.
and it's nothing to highlight or be, excited about. But it's like
Yeah.
the good news is it did not affect me in that way. So thank goodness, because if I
Yeah.
wasn't familiar with your exercising well methodology, um, I probably wouldn't be doing much of anything.
So you read this article and it sounds like your initial reaction was, what I'm doing is pathetic compared to these people. Like, I'm not doing anything compared to them. And then you went to think, oh my goodness, like, how is this article making me feel worse about myself when actually I am doing strength exercises?
Yes, I mean, thank goodness I've been getting really good results from the strength training I've been doing. So there again, it's like, hey, the evidence is right there, you know, which gives me more
Hmm.
confidence,
Okay.
you know,
Yeah.
because I have
Yeah.
evidence, personal,
Right.
experiential evidence. But
Yeah.
yeah, gosh. So I guess my question would be, how do you counter, with what you do with, you have a way of countering that.
Mm. Yeah. Yeah, because this article
Eh,
is not a one-off. This is really what's out there about exercise, this athletic approach, this extreme, this kind of bigger is better, more is better, all or
Yeah,
nothing kind of approach. Even medical advice, right? It's like, well,
yes,
if you're doing 150, you're doing 10,000 steps, go to 15,000 steps,
yes,
keep doing more, and there's never quite an enough. And I like how you were able to really tap into that initial kind of comparison. I'm not enough. I'm not doing enough. My results are not enough compared to this, and catch that. But you were able to really tap into that and really notice it. That's pretty cool because you're,
yeah,
that mindfulness
yeah.
skill that you have.
Well, and I feel so thankful, that I have that.
Yeah.
And, I'm a psychologist. I work with clients. They deal with these very same things.
Mhm.
And, I want to be able to share things with my clients that will help them counter this same
Yeah.
message.
Okay.
Um, Messaging that's not helpful to
Yeah.
many people.
Yeah.
And
So, yeah.
if I can say
Go ahead.
one other thing about the article, again, what concerned me about it, every single example was, in
Mm,
my opinion, something over the top, or, it's like,
right.
okay, where's just the average person? Or again, something that you specialize in,
Right.
people who are dealing with fatigue or injury or pain, or just low motivation. That's kind of your thing. Uh, how would a person, with any of those mindsets, reading that article, I don't think they would walk away feeling better about doing something.
Right. Yeah. Yeah. Why isn't it newsworthy that somebody is just doing a regular old exercise and going from one time a week to two times a week? Why isn't there an article on that?
Yeah.
I know. So I wonder if we apply the Be Well Now method to this and take it through and kind of see where it takes us in terms of a little bit of sorting this out to get to that well states, because it sounds like this really triggered for at least a moment a stress state in you, and you were able
Mhm.
to capture it and then bring yourself back to the well state. But I would imagine a lot of people would read that and be like, oh, I can't do strength training, I can't hire a trainer, I can't, box, I can't do that, I've got this knee pain, and their brain would throw out all these different reasons why. And then they might go to, well, I'm just being lazy, I should just push through it, why can't I suck it up, I used to be an athlete, I could do that, and I would imagine that whole spiral loop of self-criticism would just go on until they just decided they can't exercise.
Yes.
Yeah.
And if I could add one other piece in there also, of course, in addition to each woman being highlighted and what she was doing, it was all the magnificent results they were getting. You know,
Mm,
this, and this, all these great things happening. But I would just have to say that from what I know in my aging body, that that kind of approach, it would be causing injury. It would be
yeah,
so unpleasant, either while I was doing it or, I wouldn't be able to force myself to do it. So
yeah,
I guess again, if they're getting those results and they're happy with them,
yeah,
I'm not going to argue with it. I just feel like I'm speaking more for the average woman, the average person that's
yeah.
just trying to live an average, ordinary, spectacular life. You know,
Yeah, yeah, and
that
you
that,
don't
that
wanna
really
have
that
to. Yeah.
yeah, that has a life, or
Yes.
is living a life.
Yeah,
Um,
yeah,
that's
and
who
and
I
your
think is kind of
hobby.
getting left out.
Yeah, and your hobby is not to go to the gym. It's not your hobby and your recreation to go to the gym, that's just part of it. So, yeah, so if you're listening or watching and you are an average person who just wants to age well and doesn't wanna be an athlete and doesn't want that pressure to have to do that, this is for you. So let's start with just being, like, let's just get to the present moment because we talked about kind of that reaction. Let's get to the present moment
Mhm.
and just take a moment to just kind of check in and notice where your body is. And as you know, Jan, if we start in the well state, then our conversation goes a lot better because we're not going to react or be fear driven or fear motivated. We're going to have that motivation from that well state. So it
Mhm.
starts with just being present and meeting yourself with kindness to just say, you know what? This is hard. Sometimes exercising is hard as an adult, especially as you accumulate injuries. And so just giving yourself that kindness to like you would a good friend saying, yeah, that's really hard to be in a body that's limited or a life that's limited and you can't live up to what you just read. So just taking a moment to pause and notice thoughts, emotions, how your body feels, and putting your body in a position that just lets it rest. Like you're just your easy, natural position, feeling your breath always there taking care of you. And then let that breath kind of draw you into what you know in your center. We know a lot about exercise in our head, and it's a lot of shoulds. But if we go down into our center, that's where we know what we value. And this is very connected when we're exercising, it's very connected to what we value in life. So I'd ask you, Jan, I'm doing the same thing right now. People who are listening or watching, just kind of get to that value level of what is valuable to you about your health and well being and how you function, especially as you age. To playing
Yeah.
with kids, grandkids, playing pickleball, being able to go travel, whatever it is for you, just connect with that deeper meaning, that deeper purpose.
Yeah.
Yeah. Yeah. And then now we'll just kind of move forward. And by the end of the session, by the end of the podcast,
Mhm.
we'll have some action points to take to move on well, to move from that point of being well, so that when you do read an article like this or talk to somebody like a friend who's like, oh, I'm doing this heavy workout, come work with me. And you're like, no, thank you. That you can get yourself back to the well state and not be feeling stressed and less than because
Mhm.
you're not doing what that person does. Yeah. I hear this all
Mhm.
the time, Jan. So I just like to normalize it. I
Yeah.
hear this
Yeah.
constantly, constantly. People having family members who are athletes and wanting them to do the same thing, but they've got knee pain and extra weight and it's not for them and they feel embarrassed and isolated. Um,
Mhm.
and so I think this is a really important topic. Thank you for bringing it up. Yeah. So now that we kind of are starting in that place of being present and connected to what's most important to us, um, I'd ask you, what is that comparison of that reading that article and then what you're doing now? What makes the difference
Mhm.
for you?
Yeah. Yeah. Um, I guess to me, again, and just physically in my body, the kinds of things that register, discussing this are, I just feel such a huge sense of relief
Mm,
is one of the things. I don't have to take that approach
yeah.
to get results, and fulfill what my why is.
Yeah.
Just wanting to enjoy being in my body, to be mobile, to have the strength and mobility and stamina to do the things that I want to do,
Yeah. Yeah.
which is coming straight from working with you. So I guess in comparison, this is what I would do. And we could probably, hook the be well now. All
Mm.
those three components
Mm.
are kind of activated when I'm doing whatever kind of
Mm.
exercise I'm
Yeah.
doing. But I'll go with the strength training because that's the topic. That's what the article was based on. But there's such a difference now in how I do the strength training. I'm doing
Mm.
the same machines, basically the same type of workout, but
Yeah.
it's a whole different experience.
Ah.
And number one, I don't know where you would say this fits into the Be Well Now method. This would be a question I'd like to ask you. But
Mm.
I guess the first thing I would say, I'm getting myself to the gym.
Mm.
And
Yeah.
interestingly, let's say if we start back at the first of the year of thinking about how, I'm paying for this membership, why don't you go ahead and use it? Or there's
Yeah.
other things I like about being there. They have a great little cafe. It
Yeah.
gets me out of the house,
Yeah.
et cetera. Uh, it's like, well, why aren't you showing up? Why are you not going?
Mm.
And usually when I become aware of that, I start asking myself a question, something like, what would it take, Jan,
Mm.
for you to want to go? What would it
Yeah.
take?
Yeah.
And I was coming up with crazy thoughts like, well, maybe it needs to be part of an experience. I'm taking myself out for the day, and it's not
Mm.
just to drive there, work out, and then rush back home, but it's like, and then make sure you have a sandwich afterwards, or have a place to sit in the cafe and have a cup of coffee and check your email, or you go shopping or
Yeah.
something, but it's kind of like this little experience. So that's my first wild and crazy, notion. But then when I actually got there, the mindset change I had to do of, okay, here are the
Mm.
machines, but I'm going to use the weight that feels right for me, not from my old chart of where
Yeah.
was I when I stopped this
Mm.
because of some injuries. Uh, don't know what's the right amount of weight, what's the right amount of reps, and when I will get tired, I will stop. Or actually, even more interesting, just when I start to notice I'm starting to get fatigued, it's
Yeah.
like just go ahead and stop now. Don't
Yeah.
don't try to push for those last few.
Yeah. Yeah.
No, go ahead and stop now
Yeah.
and rest, and then you can do a counter stretch or whatever, and then go into your second set.
Yeah. Yeah. So
So,
compared to,
so
yeah. Go ahead.
with
Go
what
ahead.
I just said, though, how would you say that fits into the Be Well Now method, the
Oh, I think,
exercising well method?
yeah, you're using all of those, like the Be Well Now method is really a cycle. And I heard so many elements there. Just that sense of pausing in the beginning of the year and noticing and not beating yourself up, but getting curious. So instead of criticism, you went to curiosity. Gosh, I wonder
Okay.
why I'm not using that. So just that's the B step is meet yourself where you are. And rather than, or, if you notice that you're being critical, bring in kindness and curiosity instead to say, oh, that's so interesting that I'm not doing this. What would really make it? And just that curiosity opened up your mindset to the creative possibilities of how could I do this? And then you went right into what you value, which is I value having a good time. I value taking care of myself, making an experience. I value that. I mean, this is evident in I've been to your house, I've been to your office, I've seen, you create an experience. And that to me is something that you value, Jan. That's something that
Okay.
a value that you embody is what's the experience for this person? And you're doing that for yourself. What's the experience for me of going to the gym? This isn't just a just do it kind of thing. I want to create an experience of me going to the gym to be positive and uplifting and nourishing and all of that.
Yeah.
So that I heard so many values of yours in there. And I think that for anyone listening to really notice, like, what do you value? What do you like to give to other people? How can you integrate that into yourself? Right.
Yeah.
whether it's
Yeah.
time alone or time with other people. So integrating our values and our strengths into that. So I heard you doing that. And then now, as you started to do it, you went back to being meeting yourself where you are and being present and kind, and not pushing through and saying, all right, well, I have to get back to where I used to be. I can't believe how weak I got, and then going into that criticism and comparison. Instead, you were like, okay, this is where you are. It has to feel good now if I'm going to come back for more. And I know that was one of your big takeaways, that we've talked about, that, oh my gosh, exercise has to feel good now, which is why I call the Be Well Now method, like not be well later, not get to the goal,
Yeah.
but if it feels good now, we know from neuroscience, we know from physiology that you're healthier, and your brain's going to say, hey, why don't we do that again tomorrow? That was really a nice experience. So you pull in all of those elements of this method that, yeah, don't show up in an article like that. Nobody in that article said, well, I mean, they might have said, well, I started slow, or, I did a little bit, uh, you know, they might have had elements of that, but the overarching theme in that push harder is don't stop when you feel comfortable. Don't stop when you have pain, push through it,
Mhm.
or you got to do more. You got to do more than you did yesterday. You got to do more than you did before. And let's go to a competition to prove that, And so,
Yes.
and so you were able to really stay intrinsically and autonomously motivated. And we know that
Yes.
that's the most lasting.
And I'm so thankful to hear you say this, though it hadn't even occurred to me. Yeah, it was more of a curiosity mode than a
Yeah.
critical mode. And
Yes.
and and there's also a negotiating aspect of it. But
Yeah.
I do a lot with negotiating with my clients,
Yeah.
or it's such a but it's basically, what would it take?
Yeah.
It's
Yeah.
not just like, why aren't you going, but it's like, well, what would it take?
Right.
Well, that's kind of getting into the why, isn't it?
Yeah.
Of
Yeah. It
why are you
really.
doing this? And I don't mean to imply that every day it's like a little spa experience. Sometimes
Yeah.
I am in and out,
Hmm.
but
Yeah.
it's like, how can I make this something I'd want to do? And then once I got that going, yes, you're exactly right. It was kind of easy and natural to add in the second day,
Yeah.
you
Yeah.
know.
Yeah.
So
The other piece,
interesting.
yeah, and I want to shine a light on the fact that your initial response, like the initial response to reading that article, went to comparison, went to kind of this criticism, my little pathetic workout
Yes.
kind of thing. You had a moment like that because that's what our brain does, right? You know this, like our brain and body are hardwired to keep us safe. And we do that by comparing to other people. And so I think what I would love to pull out of this is the fact that that's normal. That's your body and brain taking care of you. It's how you respond to it, and that negotiation, right, that you do with clients, that self negotiation that you did with yourself. When you do that with a kind voice rather than a critical voice, like, okay, come on, get tough. It's time to toughen up. And you do more of a, kind of drill sergeant kind of
Mhm.
voice versus a friendly voice, like, okay, come on, this is important to you. What can we do here? How can we make this better? It's a very different internal dialogue. And you talk a lot about the
Yeah.
inner critic, right? And that inner
Mhm.
pusher. So I'd love to hear, how do you help clients, because that inner pusher is going to come up. It's there. It's what keeps us moving forward. How do you help clients talk to that inner critic and that inner pusher in a way
Yeah.
that doesn't let it take over?
Yeah. I would say in this experience, there's two or three things. So I'm having to, there's so many. It's so much fun. Which one? Which one to highlight first? Um, Certainly. Okay, I know what I'd like to say. One of the things that I like so much about what's starting to happen in me and my lifestyle, and what I feel like I have to offer clients, is less intensity and more peace and more peace.
Mm.
And I guess so I'll be more specific about that. But any of the ads that I see, or there's an intensity, you
Yeah.
know, and it's like that's I guess a hidden message that
Mhm.
you can't go into the gym and just kind of have like I told my one of the ways I got myself to go this week
Yeah.
is because I was kind of like wavering a little bit. It's like, well, do you feel like you need to go, or do you want to go? Sometimes
Mhm.
it's just absolutely clear. I
Yeah.
need to go. I want to go, whatever. But this was kind of like, well, what do you think? Because you don't usually go on Tuesday. So, do you want to go or not? I was like, well, I'm not really quite sure, but I think I'll go anyway. And I thought, but what my thought about it was, again, this kind of, I guess you call it an internal negotiation. It's like, well, what would it take for you to want to go today? Well, I'd like to do a lightweight workout.
Hmm.
Okay, who says that? Who would say that? I just want to
Yeah.
do a lightweight workout, But it's like, because that's nowhere near enough, you know. There's inner pusher and inner perfectionist or inner critic, both, piling on to that because then it's like I guess our mindset is it's got to be intense.
Yeah.
And it's like, what if you don't want intense that day? What if you just really need to kind of chill and relax?
Yeah.
And yet I'm still getting the workout in. I'm
Yeah.
still benefiting more. But
Yeah.
number one, it got me to show up,
Right. And how did you
and then
feel when you walked out, when you were doing it and as you were done? What was the benefit? What did you notice how you felt?
I felt great. And I was so glad that I came. But if I'd had that
Yeah.
inner pusher, it's got to be intense, you know, and
Yeah.
and you got this, or keep going,
Right.
or whatever, five more. It's
Yeah.
like I wouldn't have shown up.
You wouldn't have gone because you couldn't do all, so do nothing then, because if you can't go big or go
Yes,
home kind of thing, like either give it your all or don't. So if you can't, then why go? And you would have
yes.
missed the chance to feel great that day, right?
Or here's inner critic, inner perfectionist, which are basically the same thing. It's
Yeah.
like you have to do it right.
Yeah.
And if it's not intense and it's not
Right.
all in, and you're throwing up by the end of it or something, it wasn't enough. You didn't do it right,
Yeah.
uh, and you weren't like massively sore after or
Right.
something. It's like you're not doing it right.
Yeah.
So
That's such a good
I
Go ahead,
just
sorry.
feel this sense of, like I said earlier, one of my markers is I feel a sense of relief, and I
Mm.
feel a sense of now I forgot the word. Here's the other word that came in. I'll mention that too. Empowerment,
Mhm.
freedom. That's the word I
Yeah.
was looking for.
Okay.
I feel a sense of freedom about being able to do this. And I want to throw in one other thing, because if you have a strong inner perfectionist, and I happen to have one, so inner critic attacks can happen. So another part of the negotiation is, how can I show up at this gym? Because I am nowhere in the shape that I used to be,
Yeah.
and I don't want anyone to see me.
Mm.
Well, guess what? I go at off times.
There you go. Nice
Yeah,
negotiation
it's
there.
like, hey, you go
Yeah.
on a late Sunday afternoon, nobody's
Yeah.
there,
Right.
or it's like, well, don't go at the high traffic times. And the other thing that's great about it is I can get the machines I want. You
Yeah.
know,
Yeah.
there's not a lot of waiting. Or annoying people
Yeah.
around.
Yeah. Jan, you know what
But
I love? I love when you talk about the conversations that are happening in your head. I want to be in your head. I want to be in like that Inside Out movie. I want to see like the control panel in your head because it's so like civil. And you talk about these as committee members, right? And I picture like
yes,
this committee or that control panel, and it's just so civil. It's like, well, okay, what do you want to do? And you talk to your inner pusher with this nice, kind, very understanding, patient, very patient with your inner critic and an inner pusher, rather
yeah.
than criticizing the inner pusher. You're very patient with it and value it and see its value. And then the inner pusher kind of comes back and comes around. And there's not this internal war. And I love hearing you talk about it because I'm like, gosh, what a nice place to be in Jan's head. Like,
Well, just trust me, it's not always a nice place to
I'm
be.
sure. I'm
It is
sure.
not. Yeah.
But I like the way you talk about it because that's a nice thing to, if we could kind of picture what's the movie scene in our
Yes.
head, and
Yes.
we could picture these committee members all getting along rather than them kind of butting heads and respecting each one of them. I love that. I love that way that you talk about it. I've learned so much from you about respecting all of those parts of us because they have value, and how to have those inner conversations and self-talk so that it's
Yeah.
not stressful, it is peaceful. And
Yes.
and you're using exercise to be well now, to be well, not
Yes.
in a stressful way from even just the moment you think about it, in the way that you're thinking about it. And for a
Yeah.
lot of people, that's not true. Thinking about going to a gym is very stressful when they're tired because they're butting heads against those two voices. So I think you've
Yeah.
presented a really nice way to an alternative way to when you're struggling, how to talk to yourself in a way that might help you get there and still enjoy it and use exercise to get out of a stress state rather than cause a stress state.
Yeah. And if I can go into results for a moment, is what's
Yeah.
interesting is when I added in the second day of strength
Yeah.
training this past month, I had it wasn't until then that I really started to notice
Mm.
results.
Yeah.
And what do I mean by results? I feel stronger.
Mm.
I mean, I'm performing with more strength.
Yeah.
I can feel the strength in my
Mm.
muscles. They
Mm.
feel different, and I like it. It feels good. Um, so it's very, um, it's self perpetuating.
Mhm.
It's like you just let the results come in,
Yeah.
and you will automatically be motivated to keep
Mhm.
going
Yeah.
and do pretty much the way you're doing it
Yeah.
because it's working.
Yeah. And that's what research really supports, that 1 day a week is good. You will get some strength from that. 2 days a week, you'll probably get a lot more. 3 days a week, maybe you'll add a little bit more. After that, there's no greater benefit really, unless you're
Ah,
splitting up muscle groups and all of that, which is a
mhm,
bodybuilder way, which is going to take way too much time. So 1
mhm.
to 3 days a week, I like to give people ranges, right? 1 to 3 days a week. So on those busy weeks, if you get 1 day a week in, you're going to at least maintain, maybe gain some strength on the weeks that you have more time and energy and motivation. Yeah, 3 times a week. But if you've got a range and you know there's a level of enough that you don't have to keep going beyond 3 times a week. And if you hit one
Ah,
time a week, so I think that's really important, that, is not often seen in these articles, that it's like, well, keep doing more and more. There's never enough. I like the
yes,
ranges because they're very physiologic based. They're based on
yes,
physiology of how much is enough to get strength, 1 to 3 times a week. How much is enough for stamina? 3 times a week for 30 minutes. More is
yeah,
not necessarily better. You're not going to get more over an hour than doing 30 minutes 3 times a week, or you could split that up in 10-minute bouts. So
yes,
it's the consistency that's more important than the intensity or the duration. And
yes,
you just really gave a very nice example of how to focus on consistency and
yes.
give yourself a chance to stay in those ranges consistently so you do get results. So you do feel like, okay, I am feeling better from this.
I am so glad to hear you say that, and especially the part about after a certain point, there are
Yeah.
no additional benefits.
Yeah.
I'm so glad, I'm sure you've said that before, but I'm so glad to hear you say that again because, but again, that's why I like working with you. These mindsets are so pervasive and
Mm,
so deep that
yeah.
I continue to catch myself, you know,
Yeah.
uh, encountering in myself that old mindset.
Yeah. Yeah. They're
And
just
it's
all
like,
over the place. Yeah.
yes, but how and how yes, I'm glad I'm getting results, but also like it's still that's why this is a continuing journey with this.
Yeah.
This is why I want to keep talking with you
Yeah.
because you're pointing out things that I didn't see.
Yeah.
Which is one of the things I like to do for my clients. So it's nice to, have it done for me. It's nice to
Yeah.
receive it, you know.
Yeah.
But definitely that part about, after a certain point, there's no point.
Yeah.
There was another part of that that was awfully helpful to hear. Yes, it was the
Yeah.
part about how much does it take? It's based in
Mm.
physiology.
Yes. Yes.
That I think I remember what it was. Is that like, oh, I'm kind of like tracking with what the evidence shows that
Yeah.
it's once that second time a week kicks in,
Yeah.
boom,
Yeah.
then you really start to see a
Mhm.
result.
Yeah. And
That's noticeable.
yeah, here's what's also missing in a lot of the articles or even research studies or things that I hear from medical providers is that you don't start with 2 days a week, 3 sets. 12 reps of maximum. Like you don't start there. And we talk about the guidelines like 150 minutes a week. You don't start with 150 minutes a week. Like if you go from
Mhm.
doing 0 minutes a week to 150 minutes a week, that's a huge increase. Our body can only increase by 10% per week, physiologically,
Yeah.
10% per week. And
Ah.
so most beginner workouts, right? How long are most beginner workout videos? An hour, maybe 30 minutes. That's not beginner. So
Mhm.
I think that
Mhm.
this is, I'm so passionate about this and I get really riled up about it because I find that most people start stressed because the recommendations are starting too high. There's no like gradual
Yes.
progression, which is
Yes.
a principle of exercise training is gradual progression. But instead we
Yeah.
say, okay, do 150 minutes a week. And then if you do that, do 300 minutes a week. And we never give people this how to start well, how to
Yeah.
progress gradually. So the fact that you started with 1 day a week and you made it feel good and then you wanted to go for that second day, you really set yourself up so well with this nice strong foundation of, hey, this is something I do once a week that's really nice and makes me feel good. I want to go do that again. Your survival brain really wanted you to do it. It wasn't something you had to convince yourself all the time to do,
Yeah.
you know?
Yeah.
And so,
And I
yeah,
would
I like how you did that.
and I think that's another curiosity thing too. It's
Yeah.
like, well, what would it be like to try it twice a week?
Yeah.
What would that be
Yeah.
like?
Right.
Here's the thing I was trying to get to earlier. You said that I'm so thankful to hear is emphasizing consistency
Mhm.
over frequency.
Yeah.
you know
Yeah.
that yes,
Consistency over intensity. Yeah.
I'm so glad you're highlighting that
Yeah.
and emphasizing it, that so if it was one time a week, it was one time a week,
Yeah.
but I was getting enough benefit that it was drawing me back. And
Yeah.
then just kind of like easily and naturally you add in, but then now we're talking motivational interviewing. It's
Yeah.
not like in my head, oh, you're going twice a week, let's pump it up to twice a
Right.
week. No, it
Right.
was just more like, well, that this is feeling good. Wonder what it would be like. Let's
Yeah.
explore that.
Yeah. I use visualization even to say, what would it be like if I went again? That would be kind of nice. What would it take to do that? Yeah. And that was really value driven, right? That was really when you ask that question, it's like your head's not answering. The what would it
Yeah.
be like? And the visualization is really value driven. That's not necessarily your brain,
Yes.
your logical brain talking, right?
Yes.
Yeah, yeah. This is
Yeah.
really, I think the intensity piece that you talked about before is so we value intensity in so many things, right? And marketing is set up to trigger a quick like to make us think quickly and do something and react. So when we're surrounded by marketing and everywhere we look now, marketing, even someone's Instagram feed is really
Mhm.
marketing.
Mhm.
If someone has an
Mhm.
Instagram feed, they're marketing something to you. They're giving you information, but they're trying to get you to take action to do something. And so
Mhm.
it's the intensity is there to capture our survival brain to say, you need to do this now. This is important. This is a threat. And
Yeah.
to be able
Yeah.
to stay curious and say, all right, but what would allow me to feel good about
Yes.
doing this? What do I
Yes.
need?
Now I do have a confession.
Okay, we'll take
So
turns.
this probably, I don't know if this comes from inner pusher, inner perfectionist, whatever, but I am, I guess, like most human beings, a little competitive at times.
Yeah, competition is
so
great.
so one of the things that I find myself chuckling about when I'm doing these workouts at the gym is, I mean, I'm like breathing, and I mean, I make noise, and there's these ridiculously low amounts of weight on, I guess, compared to some some people, but I guess I just feel like I can't help but feel a little competitive, like, here I am just doing this little thing, and if you saw me you'd think like, God, that's nothing, and but you know what, I'm getting results.
Hmm.
I'm probably getting better results than you
Yeah,
are.
yeah, right,
Do you see
right.
what I
Yes, yeah, you
but
went
it but
from
it's
this external competition to what everyone else is doing to what you want, and that internal sense of competition of, "No, I feel better," and that internal competition is really what matters, am I feeling better?
yes,
Yeah.
and just kind of being very pleased.
Hmm.
I am getting results. You
Yeah.
may not look at me and think that I'm doing anything, but I know the secret, you know? So,
I'm happy to share it.
yes, you
Yes.
know? Uh, so, um, anyway, that's just been kind of fun.
This is so fun. And there's just, if we can laugh at this stuff and just say, gosh, that's so funny. I read that article and it just sent me into this shame storm and this, and we can just say, gosh, that's so interesting. But I know now that I don't have to, that's not real. That's not real. And
Yeah,
so, yeah, so some questions I would say to keep asking when you find you're just staying present and noticing when a health behavior, whether it's exercise or eating a certain way or even a stress management technique, kind of triggers that tension inside, that inner pusher that, we know that feeling. We know that feeling of just feeling some discomfort inside, dis-ease. So when
yeah,
we talk about a health issue and you get that little creeping in of dis-ease inside, that is a moment to pause, be present, take a moment to kind of like respond with kindness. Oh, that's so interesting. Curiosity. Gosh, wonder what that's about. Huh? What's really important to me here? What do I really
mhm,
value? Is that important to
yeah,
me or what do I really want? What's below the surface? Okay, now what can I do? What can I take from this that might be inspiring? And what do I know inside about myself that I can do that allows me to move forward in a well state that's really going to serve what's important to me? And you just summed that up so beautifully, that process. And
yeah,
what I like to say, stress is not a bad thing because that stress, that distress that we feel is really a great red flag. When we start saying I should go to the gym, that's not a problem. It's an invitation. That
mhm,
distress that we feel if we read an article or listen to a podcast, that distress is not a problem. It's an invitation. It's there to kind of wake us up and say, "Ooh, you've left the well state, my friend. Let's get
yeah,
back to being well. Let's do
yeah,
something to make you well, not keeping in this stress state." So
yeah,
take that as an invitation and thank your body and your brain for telling you that. And I thank you for bringing this up, Jan.
mhm.
I'd
Good.
love to
I'm
hear your
glad.
takeaways of what you would, yeah, what would you
Um,
advise people listening?
well, again, um, I think again one of your specialties is people. I mean, and I would have fit all of these categories when I first started working with you. Fatigue, pain, and some of that pain associated with injury. Um, from I would say now, looking back, over exercising, and just low motivation. So those all those things were what I was experiencing when I first encountered you, and one of the mind blowing first concepts of it has to feel good while you're doing it.
Yeah,
Uh, so what am I trying to say? Um, I am not someone who would be good at forcing themselves to do something.
yeah,
So if you're the kind of exerciser that can make yourself go, you work out and you're glad, you feel better when you're, done, okay, fine. But that person is not me.
yeah.
So there are those of us, there are many of us that we can't make ourselves do it,
Right,
you
right. And
know?
you're still okay. You can still be healthy and exercise.
Yes. So the big shift was being very mindful and aware of are you enjoying this? Or are you pushing? Are you straining? Are you forcing in any way? Because, with my prior yoga training, I certainly had much more body awareness, but there still was that inner pusher, thing going on. Yoga
Yeah,
doesn't make that go away. You can have an inner pusher driving your yoga practice.
yeah,
Uh, so I just say this transition and transformation to make it feel good all the way through. Don't I'm not going to be able to wait till the end and say I'm glad I did that. I mean, sometimes, when I was doing that experiment,
yeah,
yes, but that's not going to be a motivator for someone like me and those like me
mm,
uh, to do
yeah,
that. Um, so, and I guess here's the other thing. It has helped me tap back into. I do have a natural love of movement, of
mm,
exercise. I
yeah,
like it, and I had
yeah,
lost that for
mm,
a number of years, and just being able to tap into that again. That's just
yeah,
kind of a natural connection. I feel thankful that I have it,
yeah,
because there are people who don't have it, and it's going to
right,
take a different, that has to be recognized too. There are
yeah,
all kinds of different people on the planet, but this is something I can tap into my love of physical activity and
Yeah.
how to rediscover it and tap into it.
Yeah. Wow. So
Yeah,
much
I
there.
feel,
And this,
yeah,
so I'm hearing you say like there's all these different avenues, right? If you are someone who wants to do competitive exercise, it doesn't have to feel good now. That's not the goal. But if you are somebody in that camp who wants to be healthy, that wants to be well, doesn't want to spend a lot of time and energy and money, it doesn't, you don't, there's another way to do this. If you fall in the other category of somebody who maybe enjoys being physically active and you want to get back to exercising and enjoying it, or maybe you never have, but you want to discover how you can. You want this to be
yeah,
something, you want what exercise has to give you, and you want to figure out how you can enjoy it. And that doesn't look appealing. The other way doesn't look appealing to you. There might be another way to actually enjoy exercising.
yeah, yeah,
Yeah. Beautiful,
yeah,
Jan. Thank you so
yeah,
much for adding your expertise. And especially, like, I love the inner pusher thing. I think so many people can identify with that. And
yes,
it really, you brought up such an important point that I think a lot of people end up reading an article or listening to something and thinking, well, guess I can't exercise. That's not for me. I guess I'm just lazy. Yeah.
yeah,
So thank you for
yeah,
turning that around.
yes. And I think, as we're coming to a close here, I think this is kind of what we have to offer people with these
Yeah.
podcasts is
Yeah.
basically doing what we were doing today of sharing information and experience along with expertise.
Yeah.
And I'm just
Yes.
looking forward so much to continuing to be part of this with you.
Me too, Jan. Yes, I'm really looking forward to you being on this Be Well Now method podcast because you embody it so well, and you have informed it so well through what you're adding, what you add to it, and you help me understand psychology and behavior in a way that is so kind and compassionate and effective, whether it's an executive or whether it's someone like me who is just, just wants to enjoy life a little more with a little more depth. And I
Yeah,
love that your methodology really does that. So thank you for being part of this.
yeah, yeah. I'm just very. I can't wait for the next one.